rise today to recognize the significant legislative victories the Senate recently delivered for women veterans with the passage of 2 pieces of legislation to modernize breast cancer screening policies and the delivery of life-saving care for women veterans. Breast cancer is the second most common cancer for women. For women veterans and service members, the incidence of breast cancer is estimated to be up to 40% higher than the general population. Given the dangerous environments in which military members serve and additional risk factors associated with these locations, it's long overdue for the Department of Veterans Affairs to update its policies for administering mammograms. We know early detection is crucial to preventing and treating breast cancer, so making sure those who are more vulnerable receive screenings at a younger age is not only reasonable but critical. This would have helped Dr. Kate Hendricks Thomas, a Marine veteran, who was unaware of her increased risk for breast cancer. She shared her memories of deployment to Fallujah in 2005 with the Senate Veterans Affairs Committee last year. She understood the risk associated with IEDs, and she remembers the burn pits, so commonplace they were largely ignored. But she wasn't concerned with the impact of what she called, quote, the flaming poison, end quote, surrounding her would have on her own health. In a routine medical appointment with her VHA health provider in 2018, Kate thought it was odd she was recommended to undergo a mammogram. That exam subsequently led to her diagnosis of stage 4 breast cancer. She was 38 years old. That's devastating news for anyone to face, and I know the entire Senate joins me in praying for Kate as she continues her fight against cancer. Nobody would blame her for focusing on her own health battle, but she knows her story wouldn't be the last if something didn't change. That's why Kate has been an advocate for modernizing VA policies so other veterans don't experience the same struggles she's living with. We honored her activism by crafting and passing the Dr. Kate Hendricks Thomas Supporting Expanded Review for Veterans in Combat Environments Act. It will broaden veteran access to mammograms and also require the VA to compile data regarding the rates of breast cancer among members of the veteran and civilian population so we can continue improving procedures to better treat breast cancer patients. The Senate also unanimously passed the Mammo for Veterans Act to expand access to high-quality breast cancer screenings, improving imaging services in rural areas, and clinical trials through partnerships with the National Cancer Institute. The VA is uniquely positioned to be a leader in the prevention and treatment of breast cancer, taking full advantage of the department's unique capabilities, resources, and outreach will help deliver the life-saving care that veterans deserve. Passage of the Dr. Kate Hendricks Thomas Service Act and the Mammo for Veterans Act reflects the bipartisan support for improving veteran services and benefits. I appreciate Senator Wyden's support and leadership of the Senate Veterans Affairs Committee and the leadership of the Senate Veterans Affairs Committee Chairman Tester, who's been my reliable partner in advancing policies to improve the VA's care and services for women. The VA estimates women make up 10% of our nation's veteran population and continues to be the fastest growing population. Last Congress, we made significant progress to expand VA's care and services for women with the passage of the landmark Deborah Sampson Act. This was an important first step, and the legislation we passed last month continues to build on this foundation so we can fulfill the promise made to women who served in our nation's uniform. I'm pleased the Senate has approved these policies, and I urge my colleagues in the House of Representatives to follow our example and quickly approve the Dr. Kate Hendricks Thomas Service Act and the Mammo for Veterans Act so that they can be signed into law. The women who have served our country in uniform need to know we're taking every step available to protect their health. These bills are an important down payment in that mission.